Hello, hello. Welcome back to Tuesday Training. So glad to have you guys here. We are back again for another training for practitioners who are in the business of getting their clients out of pain. We're talking anatomy, physiology, biomechanics, compensation patterns, and what to do about all of that, as we do every week. Same time, same channel. Hey, Gary, glad to have you in the club seats today. It's nice to see you live and in person. I also want to welcome those of you who are watching live right now on YouTube. Look how easy that was for me to log in today. It's like sometimes the tech gods are just in my favor. So I can see the video and I'm going to pull it up right now and then I'll be able to chat with you all as well. Just use the chat feature if you have any questions or comments along the way. We're going to talk today about why I don't treat symptoms and what to do instead. Now, this is not a new topic. Like we have mentioned it a few times. In fact, I was just working with my assistant this morning and we found that almost exactly a year ago, like to the day, it was a Tuesday training where we had this same topic. And I kind of find that funny because we're still thinking about it. We're still processing it. We're still uncovering more whys and hows about it. Gary, you're nodding like you already agree with me. So I love that for you because you, I think, have been at almost every Tuesday training we've had for a long time. I feel like you've like dedicated your Tuesdays at this time for the magic that we do. So I love that you're here. And I also love that you're cool with like, yeah, let's talk about it again. Let's just keep talking about it till we get it. There's yeah, thumbs up. Okay, excellent. Yeah, and I can't remember who I was talking to. Somebody in the Schatz method, one of our alum who said, "Oh my gosh, when am I going to get it?" or something along the lines, or how many times do I need to hear you tell me that, or something about that. And I just want to offer, like right here at the top of our training today, you get it when you get it, but it doesn't mean that you haven't applied yourself. It's just the nature of how we learn. You got to hear things a few times to get it. We're only picking up 20% of any conversation that you're actually paying attention to. So that's one of the reasons why, for those of you who join me for full-on courses, I say right at the beginning, hey, like put your cell phone away, silence your distractions, just be here present. Because even when we have full attention, on a conversation, we're only wired to be able to pick up and consume 20% of what's being shared. So just by virtue of that, even if you give it 100% attention, you're going to have to hear it again to get the other 60%, other 80%, other 50%, whatever else is there for you that you get to utilize. So it's not about not being good enough. Please don't do that. If that's in your mind space, stop doing that. It's just in your anatomy. It's how you're wired. And there's nothing flawed about that. It's just how we're wired. Like, what if we just became in radical acceptance to how we're designed and how we're built and just let that be okay? And we just forewent all of the chatter about the not good enough. Wouldn't that be freedom? I mean, you guys, it's like a new moon this week. Let's just go there, shall we? Let's just be that. Okay, so we're going to talk about it again. And also, I may, add some new details, hopefully, that you haven't heard before, even if it was part of what you picked up on. I like to give a little bit new information each time. And I'm fumbling now looking back for that video that I said I could see. Now I can see it. Okay, guys. Hi. I see some of you are here live. I'm so glad you are. And the reason I want to also offer that I add new things as I grow and learn isn't to throw shade at what I've already taught. And I'm using myself as an example for all of you. It's not that I didn't know enough last year when I talked on this topic. It's not that I was wrong or less than as a practitioner. It means that I've evolved in the last year, as have you. We're in an evolutionary universe. We're naturally evolving. Even if we're sitting on the couch, we're evolving. Our cells are doing all kinds of stuff. Hi, Simon. Sometimes it's a belief issue. Exactly. So I'm glad that you brought that up, Simon. One of the things that also matters to me, is not even what I was intending to say today, guys, but this is the point. As we evolve, as we engage ourselves in other conversations, more newness comes up, and then we synthesize that with what we already know, and now we're evolving even in our ideas about things. So, Simon, you're mentioning sometimes it's a belief issue, and I was about to say, and we'll now finish the sentence. Even when practitioners, high-level practitioners, have graduated the Schatz method program, what we've noticed is that there's a difference between those who have belief issues that allow them to succeed and those who have belief issues that allow them to reseed back to maybe a mode of operating before they came through the program. And I'm not just pointing shade at my graduates at all. This is a universal thing. I remember one of the business coaches that I worked with saying, and I think I've shared this with you guys when we did Money May. I think I shared this with you. I'll say it again. It's one of those things worth repeating, even if you did catch it in your first 20%. This high level coach is an eight-figure earner, and that only matters because of the basis of what we're about to say here. It's not one of those flashy Ferrari people. It's not like that. She's an eight-figure earner. She's definitely figured out how to do some things. We would agree based on the revenue she's been able to generate, right? Okay, so she's got a thing or two about knowing how to do a thing or two, and that's great. And what she said once in a coaching session I was in with her, group coaching, she said, "Look, you guys, I know how to make this work. My bank account shows it. My strategy is proven. I keep repeating my strategy over and over again, which is one of the things I loved about coaching with her. She wasn't trying all new things every year and darting between trainings and ideas. She was like, I figured out this is what works, and I'm going to keep freaking doing the thing that works. That's what I like to preach about as well, about body work. Stay with the thing that works. Don't keep trying to find your way through an endless array of techniques. There's not a magic bullet out there. There's a formula, and that formula is going to work for you or it's not. And the one that works, stay with it. Okay. So she says the same thing about business. She's like, look, I've got the formula. I figured it out. I rinse and repeat it over and over again. I went from being broke to now making what I make, and I watched the numbers climbed as I went. And still, she said, even if I gave you step by step that exact formula, some of you will take the formula and you'll also reach eight figures or more. And some of you will take that formula and never increase your revenue. So what's the difference? Is the difference the formula? She said. No, the difference is the mindset. If you believe it, you're right. Every one of us is righteous at some point. We are right about what we believe in. So I love that you put this in here, Simon, because if you believe that there's a certain way to do it, or you believe that you're not good enough, or you believe that somehow you're flawed because you didn't know everything, then you're right about that. And is that chatter actually helping? No, it's not. So let's instead, since we're on an anatomy track here together, let's use our anatomy to just be factual. Our brain is only wired to pick up 20% of what's being shared. Even if you came to this exact training last year and I said exactly the same words, you'd hear something different this time. You just would. Your brain's also wired to have mirror neurons that connects it to things that it already knows. So if you learned something last year that seemed new and challenging, in the last year, you've had time to synthesize that, and now your brain does something different when it hears something similar. So it's just the way we're wired. It doesn't make us wrong. But because we're wired that way, we must stay training. If you really want to be an expert at the body, you got to keep training because there's none of us that knows all of it. And if we're only picking up 20%, even from an expert, we're only 20% of what the expert has to offer. You got to go back even to the same expert and keep extracting juice from that lemon. So what happens sometimes is we will work with a trainer, a practitioner, we'll go to a workshop, we'll learn a technique, we'll graduate from the Schatz method, whatever it is, and we only got 20% and we think, oh, well, see, that wasn't the answer. And we go hop, leapfrog, skip over to the next trainer, practitioner, technique, or program, take another 20% and go, yeah, see, that one didn't work either. None of these programs are working. And I've said that in the last few weeks as I've been in, enrollment conversations around those who are considering mastery this year. Is it that the training didn't work, or is it you didn't work the training? And even if you did work the training, you only got 20% of what was on offer. So we get to come back even to the same source and extract a little more data. It's one of the reasons why I do like coming live every week, because I could just say in an email, hey guys, go back and watch last year's training on this and then learn how to not work symptoms anymore. But there's something about human connection and having live conversation and different people in the chat that we can bounce ideas off of and the whole bit. So you do want to go back and stay in community. It's one of the reasons our community is so strong and one of my prized possessions in the Schatz Method community, because we get to stay in it, stay active, keep our minds engaged, bounce the ideas off of each other, etc. So we're going to do that again today on this topic of symptoms. Simon says, till one gathers more vicarious vicarious evidence. You're cute. That's funny. Could be vicarious, could also just be more factual data around the body. And I don't mean to say factual, by the way. I've been thinking about this every time I hear myself say it. I don't mean to say factual like it's etched in stone, it's only this way. And I think for those of us who are especially still like shimmying out about symptoms, it's helpful to get a little finite, a little exact, a little like period at the end of the thought. Because one of the things that happens when we navigate this conversation about symptoms is we start spiraling into all the potential possibilities and we leapfrog really far out into what our made up story is about that symptom. And then we actually end up, we call it in our community, we get lost in the sauce. Like now we've got all this idea, but we're not even sure like what was the original thought? Like what was I trying to do here? So I like to use the anatomy when I say factual more as like clarity so that we don't frizzle out. One of our practitioners described her mind space when it would get like that, like a dandelion, after it's yellow and then it turns gray and fuzzy, and just before you blow on it and it poofs all over. She described it like that one day, and it's just such a perfect visual because we all have gone there, where you're just like data, 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 data. Okay, at any moment this could all shake loose, right? And also it's fuzzy in the meantime. So I like to use anatomy as like a through way, I should say, something of clarity, something of like almost absolute where it stops the fuzziness. It just gets us to like, oh wait, okay, this is the way it is. And some of them are laws in the body, and some of it is just the way the anatomy works. So let's talk about symptoms, okay? Symptoms, what actually is a symptom? Have you guys thought about this? If you were to define to someone, anyone who's not an anatomist like us, what a symptom is, what would you say is a symptom? What's a symptom? Gary, you want to take a go at it? Haven't given you enough time maybe to percolate your full answer, but go for it.
Uh, yeah, it's your body's awareness of something gone awry. That's
Yeah,
simply
Gary.
that. Yeah,
Exactly. It's your body's
and
awareness.
it's so yeah, and it communicates in different pain symptoms, different aspects or types of pain at different times. The body is choosing to say, hey, wake up, something's going on here, or
Yeah.
something not going on here.
Yes,
Yeah.
Gary. Yes. See, it's so good. You did great. Yes, absolutely. Simon says a cry for help. Yes, absolutely. Cry for help too.
Mhm.
So I love what you said, Gary. And now this is a beautiful example of you were in this training last year. Now you've got new ideas around it, and now you're presenting differently in your own awareness around this idea. Because I do remember we used to have a lot of conversations about symptoms. You'd come in and say, "My client has this. What do I do?" Like, Gary, that's a symptom,
Mhm.
right? And so you've come so far, and I just want to acknowledge and congratulate you about that. And we all get to do that. Okay, so symptoms are a symptom is an indication, an indication from the body that something's off. And I've said awry. When the anatomy goes awry, for those of you who are in our Way of the Master Practitioner uh, training a few weeks back, you would recognize that as anything in curtain three that points to curtain one or two being a little bit off. If you don't know what the curtains are, don't worry about it. It means our body is designed a certain way with form and function. And if anything is off in that form or in that function, the body's not happy. And if the body's not happy, it's going to tell you it's not happy. So the other half of what you said, Gary, was, and the body is communicating that to the owner of the body, right? Like we're privileged to have these amazing vessels to walk around in, and we have a responsibility to be in a harmonious relationship with that vessel, with this vessel. So the body's going to say, okay, well, you're a little off now in form or function. You didn't know that, human, while you were off doing things with your brain. But me, the body, I'm going to tell you there's something a little bit off here that I'm not able to do anything about. And remember, the body tries to do something about it for a long time before it just raises its hand. So, as you said, Simon, it's a cry for help. It's a cry for help after some time, right? Like at first onset, a symptom can go, a symptom can actually be, this is going to sound like I'm contradicting myself. Something, let me say it this way, something that's off in form or function can be asymptomatic for quite some time. Quite some time. So a symptom doesn't necessarily mean pain. A symptom doesn't necessarily mean a
Hmm.
cry for help, but it can. And when it does, it's usually way past the point of the body having any ability to solve it on its own without drawing our awareness to it. So for those of you right now, for example, I've used this illustration a lot. If you're sitting right now with your low back, if you're sitting on a chair and your low back right now, your lumbar spine is touching the chair that you're sitting on or whatever surface you're leaning back against, that means that you've reversed your lumbar curve. So the body's not screaming at you like, ouch, ouch, it's terrible, because the lumbar spine is designed to flex. However, if you're sitting like that, you're not actually actively flexing those joints. You've put the muscles now in a shortened position on the slack and in a lengthened position, both being weak in that position. And the body can only tolerate that for a period of time. But it is tolerating it right now. However, if you sat like that day after day after day after day, the next time you go to do something active, like put on your socks, your low back, you might quote, throw out your low back, and your low back will be like highly symptomatic. And as you said, Simon, crying for help. But that's not really, putting on the socks was not the issue. It was the absence of optimal form and function that led up to that last active activity of putting on your socks. I'm just using that as an example to say that we are asymptomatic right now. If you're leaning back like I am, I'm doing it to illustrate. I'm leaning back. My lumbar curve is not in its neutral position, but I'm not in pain. I also have one foot tucked up underneath me. Why would I do that? That's putting my pelvis at an imbalance, and I'm not in any back pain. But if I sat like this all day today, tomorrow, and the next day, I might feel achy, tight, uncomfortable, all symptoms, active symptoms, by the end of a few days. And then I might want a massage, or I might want a stretch therapist, or I might feel like I want to stretch or something like that. And that's all symptoms of something that came before. So some chief complaints, some part of form and function gone awry can be asymptomatic, meaning no pain. The body isn't actually communicating. Our job, I believe, our job as expert body workers is to recognize what causes the pain before it's caused, before it's actualized, and then also speak to that. And I think I've done this on Tuesday training at least once. We definitely talk about it in the mastery program. That's called preventive pain. And I had a practitioner say, well, isn't that an oxymoron? That doesn't really work. Hear me on this. Yes, of course. And wouldn't it be so much easier for us to mitigate the issue before it became symptomatic, knowing what we know about how the body handles our poor form and function? Like right now, my body should be telling me that I'm hecka uncomfortable given my imbalanced pelvis and my reverse lumbar curve. But it's not telling me that. In fact, I'm quite happy right now just sitting here chatting with you. But if I know better to not do that all the hours of today in front of the computer and all the hours of tomorrow, or how someone cycles on the weekend if they're a cyclist, or how someone does yoga or their Pilates or their training or not training, wouldn't it be better for us to be able to also impart that on the people that we serve so that they don't end up in pain that leads them to us? We're still in service. It doesn't mean we put ourselves out of business. In fact, learning how to optimize this vessel is just as full time as getting people out of pain once they're in it. In my ideal world, in my vision of the world, that's all we're doing is preventive pain work. We're actually halting all the times that could lead someone into active pain or cries for help. Now, it doesn't mean that we can prevent, falling down the flight of stairs or slipping on ice or knocking your head into something if you don't catch how low the threshold is or something like that. But what if we took away most of the opportunity to create just lifestyle pain that so many of us walk around with, like holding our cell phones? I was on a few flights in the last few days in my travels, and the chap next to me on my last flight yesterday fell asleep. His chin was resting. You're on an airplane, right? Your head kind of bobbles. You're like a bobblehead if you sleep like that. I tend to lean back, but then my jaw opens up. My friend told me. But anyway, whatever. This guy, this guy next to me, I wanted to take a picture, but because he was asleep and it would have involved his, even though it was the side of his head, I was like, no, Gina, be respectful, don't do that. So I'm just going to describe it to you guys and you're going to picture it in your head and it will hurt your heart just like it did mine in real life. His chin was resting on his sternum. His spine was in a C. His chin was so far down, and that's what was preventing his head from bobbing. And he slept like that for the whole hour and a half flight. And I thought about that and I was like, yeah, it would be tempting to tell someone not to do that on a plane. However, we do that all day long when we look down at our cell phones. All freaking day long, we do that. All day long, awake. Wouldn't it be great if we could just get the word out about the indication and implication and mechanical effect that that has on neck pain, shoulder pain, low back pain, and pelvic pain? Wouldn't that be great if we could just spend our full-time work on that, which means that the people that come to us wouldn't be in such pain, that their nervous systems wouldn't be in sympathetic overload, fight or flight, running from a bear, and you might also be part of the enemy because the last three practitioners couldn't help me. Wouldn't that be so great if that's how we worked to really get people out of pain? I mean, what a dream for us and them. I would think it would be great. But that's not where we're at fully, but we could be in an ideal world. That said, symptoms are an indication from the body and a communication from the body that something's off. Form or function is off, which means then that in order for us to solve the pain, we've got to know what is off about it and not just go at the symptom. So every chief complaint is an indication of a symptom, not the source. Every herniated disc is a symptom of something else. Discs don't herniate on their own. They're designed to not herniate. Actually, there's a lot of protective mechanisms in there for them to actually not herniate. So they don't just spontaneously herniate. Something happened that caused that herniation. Muscles don't just get tight. They don't just spontaneously get tight. And some people say, well, you haven't felt what my body feels like. My body's tight all the time. Okay, great. So tightness is a symptom. Tightness is a symptom, and if we use our definition that we came up with today, that means that a symptom is an indication that something's off. Either the form or the function is off. And the tightness that equals discomfort or pain means the body is communicating to us that it can't navigate it any longer on its own, even though it's tried. And we know that it's tried because that's part of the function. It's part of the way we're designed for it to handle itself and not give me stressful responses every time I hold my body slightly out of alignment. So if tightness is a symptom and I go after the tightness to untighten it, then all I've done is address the symptom and not what caused it, which means how do I know that the tightness isn't going to recreate itself on the client's way out of my office? And then they're going to think, wow, I felt really good while I was in there. Gary really got to some, really quality spots, but it didn't really work. I felt good for a while, but then by dinner time that night, yeah, I still have this bad back. No, you don't have a bad back. What you have is form and function that hasn't been restored back to its original design of form and function. So every chief complaint is a symptom of something, even the big ones, even the diagnoses. Like I said, herniated disc. It's a symptom. It's a symptom of something. Symptoms, we've said, is an indication that something's off. It doesn't mean what we didn't say was that the symptom was an invader that should be eradicated. That disc is terrible, cut it out. Put it in a petri dish and ship it off to the lab. Shouldn't have that disc because that disc caused you problems. No, it didn't. No, it didn't. What you were doing with your body put that disc in a precarious situation that it then tried to communicate was a problem. And instead of addressing the situation, we just cut out the disc. Now, for those of you who are listening, there are times when a herniated disc operation is absolutely indicated. And the only reason is because its proximity to the nerve will erode the nerve, and nerve tissue is the slowest regenerating tissue in the body. Although it is regenerating, it might never regenerate in this lifetime. So we need to stop the erosion. But if nerve tissue didn't regenerate that slowly, I would still say don't operate on that herniated disc and just fix what caused it. There's a practitioner I was recently talking to. in the last few weeks, again on this mastery track. And she said that she had a disc fused in her neck, vertebra fused in her neck because it had herniated. Her job is one that has her looking down. We already talked about that. I don't think the guy next to me last night herniated a disc, but I certainly see how that could lead up to that over some time, especially with the bobbing. And I asked this practitioner, so did the surgeon who did the surgery for you tell you how it herniated in the first place? Oh, well, it was my job. Okay, great. And did they give you anything to resolve it so that what caused it, short of quitting your job, could be, avoided going forward? No. However, the disc above it and the disc below it are also now herniated. So that's 3 out of 7 cervical discs. What are we going to do? Just keep fusing them so that there's no range of motion? So that she can never look down again? Is that the solution? It's not the solution, guys. And I think you guys know that. And I'm just sort of like bringing some reality to our conversation here. It doesn't work. Gary, unfortunately, we get to fix what surgeons. Wait, say that again. Say it out loud, Gary. Sounds like good.
Unfortunately, we get to fix what surgeons are already fixed. In other
Mm.
words, they didn't take care of the real root cause. They took care of the symptom, and now that fix has become permanent. In other
Mm.
words, they put fusions, they put rods in there, they put other things in there that make our job much more difficult to try to get to the root cause. So I see that a lot.
Yeah, for sure. And so let's just put a layer of acceptance over that comment because I hear you. I share that with you. I'm not making you wrong here whatsoever. And we're also responsible for that patient ending up in that surgeon's hands in the first place. Because if we're not actually solving
Okay.
right? If we're not solving the
Mhm.
source enough, they're not going to think to come to a massage therapist when a disc is herniated. They're going to think, oh,
Mhm.
there's something broken in my body. I must need a doctor now. But if what we can do can prevent them from needing surgery, then why aren't we doing that? So the
Mhm.
question, I want to put it back to us as well. We're not because we're chasing symptoms. We're rubbing deep tissue work on neck, right? Because it's so tight from the herniated disc. That doesn't solve it either. So when it doesn't solve it, and something like a herniated disc pressing on a nerve up here is causing numbness and tingling in someone's hand where they feel like they can't actually move through the world, if we haven't fixed it, they're going to go to a doctor. So it's not that the
Sure.
doctor fixed something and now, kind of left us with a pile of whatever to navigate. Although that does happen, of course, when now there's scar tissue and things are fixed and fused. But why didn't we fix it before they needed the surgery? Because some of us are still chasing symptoms, my friends. We need to stop freaking doing that. So I'm appealing to us to not do that. What caused that herniated disc in the first place? What's missing? So in the case of this practitioner, well, it's my job, it's my job, it's my job. Except that there's other people in that same industry and they don't have herniated discs. So what was it about this body that needed something different or in addition to what their colleagues had? And was that added into her routine so that her discs had more protection before it herniated? Was that added? Because guess what? Doctors don't do that. So we're blaming them for fixing something that we should have addressed before. Goes both ways, right? So we need to really, we need to. I don't like to do need and should, but I'm doing it. We get to up level, guys. We get to be pain experts. We get to actually fix the problem from the root. Gary, you've disappeared on me, and I know that you're still here. Maybe it's your camera. Simon says the protective systems went overwhelmed. Yes. How many? Simon, put one more comment in there for me because your last note is just behind that heart, so I can't quite see what it says. How many somethings should arrive to? Just write the word yes so that your comment pops up. For some reason, I can't see that on my device ever. All right. So we want to know what caused the symptoms And yes, you get to be supportive of someone's symptoms, but what caused it is really where our work is. And I'm glad that this comment came up, Gary, from you about the surgeons fixing it, because we get to figure out what caused it first. Okay, Simon, how many shoulders go awry too? How many shoulders go awry? Thanks, Simon. I got you. How many shoulders go awry? What does that mean? How many shoulders? Like, you mean from herniated cervical discs? Is that your question, Simon? Or just in general? I mean, shoulders are the most precarious 360 joint in the body. So there's lots of shoulder issues that happen even just from seated posture that has nothing to do with the head, right? As soon as we reverse our lumbar curve, now our thoracic curve is off and our scapula and glenohumeral joint are left even more unstable than they are by design. There's nothing wrong with that design though. There's tons of muscles that are designed to hold our humerus onto our torso through the shoulder joint. However, our posture our posture makes that really challenging. It's one of the reasons why we do so much on posture and repatterning at the start of the mastery program. And I know I'm talking about it a lot, guys. We have this is our window. If you guys are even remotely interested in this, this is your time because we only enroll once a year. We start the beginning of July and we don't offer it again. Enrollment is closed until next July. So if you're interested in anything posture or repatterning related or what does our form and our function actually contribute to symptoms, it's literally the first 3 months of the Mastery Practitioner Training Program. And of course, you guys know from our master class a few weeks ago that this is the first time I'm offering. You can come for just the first module and see if the program's for you. You don't have to commit to the whole year, but you do need to make a decision in the next week because then we don't do it again for another year. Simon says surgeries. How many shoulders go awry in surgeries? Oh yeah, well, depends on what the surgery, it depends on what caused the need for the surgery and what the surgery actually entailed. All right. So let's move on. Gary, I see you working with your camera. I hope that you come back. Um, let's talk about symptoms. One of the reasons why I believe, so I've sort of scared you guys away from, don't do symptoms, get to the source, get to the source. But let's just put this into a little bit of context because I think it's worth acknowledging here. One of the reasons why manual and movement practitioners alike address symptoms. My hips are tight, my neck is sore, my low back is achy, my ankle feels creaky. Manual and movement practitioners hear the same things from the folks that we're in service to. What we do about it might be similar, might be different. Most of us do some sort of, on the spot addressing. We're either gonna, use our thumbs, use a device, do some pulling, do some stretching, or we're gonna walk our client through something similar like that. Stretch here, do that, or we'll just modify away from a movement. Don't do the thing if it hurts, which is good, right? It's a good option. Don't do the thing that hurts because the body's telling you this thing isn't helpful for me. But all that's doing is avoiding more pain. It's not actually solving why it hurts in the first place. Because remember, the body's designed to move, so it shouldn't hurt when we move it. So we still want to take it a step further. And instead of just modifying, which is a good step, do no harm means don't do more harm. But to remedy the problem, which is, I know why you guys, I know that's what you guys want. That's why you're here with me, because this is the conversation I have with you every week. I'm not here to fluff and buff. So I know that you want to get to the source of it too, or you wouldn't be here in conversation with me. I wouldn't be appealing to you. So, in order for us to really support someone, we don't want to modify what they're doing or tell them to stop doing the thing that hurts. We want to get to why does it hurt in the first place? And the answer isn't because that muscle's tight, because that disc is herniated. Because remember, those are symptoms. So the reason we have pain isn't because of the symptom. The symptom is telling us that there's pain in the form and function. So we're not here to treat symptoms. If you never followed me again and that's all you stopped doing, my goodness, it would change the course of work for you. For sure, it would change the course of work for you. And that said, I want to address why we go for symptoms. I'm not throwing shade. I get it. We're going after symptoms because we really do want to be in service. We really do want people out of pain. I get that. It's from a big, open-hearted, generous place to Here, someone has a symptom, a pain point here that you can touch, see, or reach that they can't, and you want to go there and like get rid of it for them. Totally get that. But we know if we use these, like those absolutes that I talked about at the beginning, we know that most of the pain in the body, 90% of it, minimum 80% of the pain, musculoskeletal pain in the body, is referred from somewhere else. So even when we know, like, oh, I know I can get to that subscapularis or that, rotator cuff muscle on the back, even when you know that you can do that, you can reach it, you have a technique, you've learned how to get to that one muscle that's hard to reach. Even when you do that, welcome back, Gary, what you're doing is still addressing a symptom. And by anatomical law, you know that means you only have a 10 to maybe 20% chance of actually eradicating the pain that they came in with. So it is a place of service and generosity and big-heartedness. I totally get that. But we want to use our rational mind about whether that's an effective approach. And we just know that just by the math alone, it's probably not going to solve it. So that means we're invited to go deeper and figure out, how do symptoms come to be? How do they generate? How does a disc herniate? How does that happen? Well, I'll give you a couple ideas, and they're not universal. It's specific to the body that's in front of you, their anatomical constitution, their lifestyle and daily habits, and whatever their body experienced in the world. So if their constitution is hypermobile versus hypomobile, they will have a different response to how they move their body and how they handle external weight. What they do with their lifestyle, whether they sit in the plane with their chin resting on their chest and take their neck into extreme flexion and hold it there for an hour, or whether they sit on a chair like me with one leg popped underneath and they do that for hours with their pelvis, hijacked and not in alignment, or if they work out with weights that are too high for them or that are not too high for them, but they compensate when they do the weights. So I like to watch form all the time. It delights me. It's like a form of artwork. And there's often upper body weights, boys and girls, men and women, who are doing upper body weights and they're sort of bobbing their head as they do it, right? They'll take their weight and they'll go into elbow flexion and they'll do, yeah, and they do this thing as they're using velocity and momentum. Totally get that. It's part of biomechanics. However, based on what's happening in the other joints around what they're actually moving, that may not be optimal for them. And when they're bearing external weight, then that becomes the source of the problem. So there's lots of places in our lifestyle that lead us up to pain, but it's a buildup. It doesn't happen in the moment, right? And then, as I mentioned, what else their body has been through. So sometimes herniated discs come from not enough muscular integrity in the paraspinal muscles that hold those vertebra in place. Sometimes the constitution makes that difficult. They need more addressing, more alignment, more intrinsic strength. But sometimes a disc can herniate because of impact trauma. And that has nothing to do with someone's constitution. They just fell and they just hit the corner of that table just the right way. Wildly different sources of the same diagnosed symptom equal pain in both bodies. So we could go after the low back and stretch it or modify it or hot towel, moist heat, thermal agent. We could do all kinds of things for the symptom of that herniated disc and not actually resolve that disc that's already herniated, or in the case of the practitioner that I talked about, prevent the next two from going down as well. It depends on those three areas to consider: what the constitution is of the body, what their lifestyle patterns are, and what other history comes in to play. And that history may or may not include an injury. It's just history. Like, they had 4 children and 2 of them were delivered as C-section. Different history in those abdominal tissues than someone who's a boy who's never been pregnant or given birth. So there's different considerations in the history of what a body comes to you with a chief complaint that says, hey, this hurts and I want help. So I brought in a lot of ideas here, and I just want to parse them out just for our own organization. First off, in no particular order, and I hope I do remember everything I brought up, what constitution the body is that's presenting to you is part of our responsibility through our assessment tools and our anatomical knowledge on the implication of that constitution. We need to know that. The client's never going to know that. That's our job. It's part of our specialty. What their lifestyle habits are, how they move through the world, and what the implication of that is on the body. Like, so I've said a few times now, I'm sitting with one foot up underneath me. Do you guys know what that would do to my body? Do you know what that does to the pelvis? Do you know the effect that that has on the paraspinals? Do you know how far it goes up and that it can actually start sounding like TMJ? Did you know that? Did you know that when the pelvis is out, that could be the source of the TMJ pain? Did you know that? Right? Because that's a diagnosis, that's pain, that's a symptom. Where does it come from? So that's again why we start mastery with that. Because most of the time, if you just change what folks are doing with their lifestyle habits, you will get rid of at least 60% of their pain. I'm not kidding you. Those are real numbers. I measured it in my own clinical practice for years. For years. I could get rid of most of people's pain by making very simple, very simple, small changes that had a load of effect down the pike. But in order to make those changes and those suggestions, I needed to know what the implication is of what is being presented so that I could, like a bowling ball, one bowling ball down the track, knock down all the pins. You guys, your clients are not coming to you for better posture. They want better posture, but they don't want to do their better posture. And you know that. You know that because you've told your clients 1,000 freaking times, don't do this, don't do that, do this, do this, do that. And they're like, uh-huh, mm-hmm, uh-huh. They don't want to. But what they do want is immediacy. And so that's why you get to learn what are all the implications of all the things that you're seeing, what's your assessment around all of those, and what's your suggestion to remedy them? What's your bowling ball? What's the kingpin that you're going to hit? Because when they make one small change and it creates all this effect in their body while they're with you, they will be very likely to do that one thing when they leave. But just tell them to sit upright, pull their shoulders back, lift your chin up, but they're not going to do that. They're not. There's got to be an immediate, tangible effect. And in order for you to create that in their body, because you're not creating it, they're creating it, but in order to suggest something that will create that kind of an effect, you've got to know what the implications are for all of the patterning that you're seeing in front of you. Literally, that's why we start the first 3 months of mastery going over that, because you do very little work, your client has very little homework, and so much changes that they start feeling better. And interestingly, your clients will come to you more frequently when they feel better than when they don't. It's real numbers. They don't feel good. They're going to go to you to feel good for a little while. By dinner time that night, it goes away, but they know that it helped. So next week, they're going to come again to get a little bit of reprieve, but it didn't really last. So then they're going to wait 2 or 3 weeks and they're going to try a couple other things, especially now in the days of the internet. Ask your clients what they've done since they've seen you last. Oh, I bought this online program. I went to go see that. A friend of mine told me to try this little thing. I bought this little device off Amazon. It all helped a little bit. They were very busy, but now they're back. But it's 3 weeks later since they've seen you. How come? Because the first 2 times it didn't work. It was only temporary. So they really will come more often when you actually get to the source of it because they know you'll solve everything that they've got. In order to do that, you've got to know the implications of what is being presented and literally mechanically walk through it in your mind, how the parts are connected and how they're responding to each other that then lead to the pain and or the symptom that your client comes with. You got to know how to do that. And then what history their body's been through. We talked about soap charting here on Tuesday training. It's been a minute. We talk about it at great length in Mastery. There is mostly there's probably most of us as massage therapists who've done soap charting, and probably the rest of us, especially movement practitioners, don't do soap charting. Massage therapists in most states are required by law to do that. That's cool. I'm talking about the necessity for us to be able to figure out mechanical implications. That's universal for both manual and movement practitioners. So whether you were ever trained in soap charting or not, I think it's a very useful and worthwhile tool, especially the subjective intake. Can't remember where I was just recently. Maybe it was here in Tuesday training where I said most of us will ask. Oh, I also asked my mastery practitioners too. We were actually going over soap charting in part of our training. I call it architecting an orthopedic session. Like, what are the steps that you take so that you can bullseye it and get that kingpin out of the gate? You got to set yourself up for that. You don't, it's just not magic. I mean, it is magic, but you're knowledgeable, and that's how you set it up. And this subjective part, taking in all this information, is really loaded with what the client's body has been through and what it did with those experiences and what it's still asking for. So we need to be able to train ourselves to hear well, and as we're listening, note already the functional and mechanical implications of what that person is sharing with you about their body and how that rolled out in their body's experience, and how their body tried to maneuver around that, because we know that it does. Our bodies right now are maneuvering around the fact that we're sitting with our lumbar curve reversed. Of course, it's going to maneuver around something more serious. Of course, it is. You roll your ankle, you can't walk on it with full weight. You're still walking, you're still making your way to the bathroom in the morning to brush your teeth. How is that happening? Because the body's making compensatory actions. We need to be able to have that patterning like sort of roll out like a film in your mind's eye so that you can understand the mechanical impact of everything that's gone on in the body. And then how is that contributing to today's symptom, to today's pain point? That's a whole skill set in itself. Simon, do you give your clients an elevator pitch about pain? About pain, Simon? An elevator pitch about pain. I don't give them an elevator pitch about pain. I'm not sure what you're asking here. Give me a few more words. Um, I don't really talk, I don't, I thought another comment came in. I don't really talk, I don't know what you're asking here specifically, so I'm sort of venturing an answer. I don't pitch them about pain because we in Mastery, I train a lot about benefits versus features. So you've heard me say this in Tuesday training, nobody really cares what you do, guys. They don't really care what your title is. They don't care how many letters you have after your name. They really don't. I mean, they want to know that you're vetted, but after that, they'll see a bunch of letters after your name. Nobody asks you what they mean. Think about it. How many of your clients that you serve have actually asked you what the letters after your name mean? Not many. I have, lots of certificates on the wall, as I'm sure a lot of you do as well. And they're like, wow, great. They're not going to read them. They don't go over and read the fine print. All they want to know is that they've done a good job vetting you. And what they really want to know is what's in it for them. What they want to know is the benefit for them for all the letters after your name and all the certificates on the wall. They don't really want to know what you know. They want to know what you're going to do for them. It's not the same conversation. So if that's what you're asking, Simon, I don't pitch them about pain. Nobody really cares what I know. You guys do because we're all at industry, colleagues. But clients don't want to know about their pain. In fact, they want to know how quickly it can go away. They don't really want to have a chit chat about it. What they want to know is what I'm going to do about it, what the result is that they're going to have, the benefit to them for the knowledge and skill that I have. What's the end goal for them? That's what they want to know. So I recommend pitching about benefits, not features. Okay, thank you for embodying your many years expertise and personifying all the principles of good practice, one and only. Oh, Simon, you're sweet. Thank you. I'm glad there's value here for you. And thank you for putting yes after your comment so I could read it. Okay, great. Yeah, I'm happy to be in service to you guys in this way. If I could bring all of you, I've said this before, if I could bring all of you with me for a couple months and we could like escape on a private island, first of all, how badass would that be? But also, if I could just pour into you everything I know and like give you a faster track, I do feel like I'm giving you a fast track, but if I could give you a faster track and practice with you and train with you and build skill at the same time, and then send you back out into your corners of the world so that the whole world would no longer even be talking about pain, to your question, Simon. Now that would be a dream come true. I think I would probably spontaneously turn into dust because my job here, my work here will have been complete. My vision will have been made manifest and there will be no purpose for me anymore on the planet. So I absolutely am here for that. So I'm really glad that so many of you are, on the mission with me and here to gobble up all the goodness. Okay, so this is the last thing I'm going to say about symptoms, unless there are questions. Gary, do you have any questions about symptoms? No? Are you hearing it differently this time than last year? Okay, beautiful. Anybody who's here live, any questions on symptoms, ask me now so that I can get them in on this full conversation. And I will wrap us up with this. What you want to do with your symptoms is remember what we said they are. Calm yourselves and make it really easy for you to not turn into dandelion dust by remembering what a symptom is. Don't let it distract you. I call it, Times Square of New York. Symptoms are like that. Pain symptoms are like that, especially the story that comes with how it got there. What you want to be able to do with that story is to be able to ID, is that chapter 3, what the body's been through, or is it just more detail about the symptoms? Because it's not the same. You want to be able to have that skill set around that. It's what one of the, requires training. You might have it already. You might want to get more of it. I'm happy to share that with you. So you want to be able to recognize what a symptom is. Recognize whether the story is around the symptom or whether the story is leading you to more information about what the body's been through. And immediately you want to go into the mechanical and functional implications of all of that. Because that's where the answer is for you. That's where you start to know what to do about all of it. Please do not come to me anymore and tell me that your client had pain in their hand and you did PNF to their hand and that took care of the pain. Sure, for about an hour. The pain doesn't just spontaneously show up. So, and it's 90% referred from somewhere else. So you know that. Use your knowing, use your anatomy to find the source. That's one of the reasons why I show up here every Tuesday, because I want to give you guys that anatomy. I want you to have so much anatomy that you're almost in that finite, like this is the anatomy, this is the anatomy, this is the anatomy. That's what we do here on Tuesday. I'm teaching you the anatomy. I'm teaching you the function around that anatomy. I'm teaching you the laws of the body and things that can help carve through that clarity so that you can actually apply the anatomy that you know. What we're not doing here on Tuesdays is I'm not teaching you techniques. I'm not teaching you the Schatz method. And I'm not here to say that you should or shouldn't learn techniques or the Schatz method. What I'm saying here is that we're using our anatomy to inform us on what it is that we want to learn next. If you know a technique and you don't actually know the anatomy behind it, or the mechanical implication of the pain that is presented that you think the technique will solve, then the technique isn't really serving you. You're just being a puppet. Same thing goes for the Schatz method. There's a few places inside the method where you could do this, you could do this, you could do this, but most of it's a method. It's not a technique. But there's a few places in there where I'm like, try this, try that, try that. And there's just this natural tendency to want to be like, well, I tried the thing. Cool. Based on what? What are the implications of the pain and the source of the pain and the history that that body's been through that you then put action on? That action is a doing, could be a technique, could be something else. But why are you choosing that? If it's to get rid of the pain and the symptom of pain, you missed it, my friends. So let's take our conversation a little deeper. Let's use the anatomy to help us understand what the body's been through and the story around the source of it. And then you can use either a technique or a method to really get underneath it and do something with. And it's really valuable because when you're working at higher levels, when you're working on more complicated orthopedic cases and you're also doing more advanced type work, you have to have the anatomy to back you up because it's literally what you're working on is the anatomy. As we said at the very start of our time here today, when you shared your definition, Gary, of symptoms, the symptom is the indicator that something's off. Something being the anatomy, and off meaning how it's supposed to be in use. So we have to have that foundation of anatomy to do higher level work and complex cases and involved techniques. We have to have the anatomy. If you don't have the anatomy, then you can't, I don't believe you can solve the symptom. So I want you guys to have that. It's one of the reasons why we're here, like I said, every Tuesday. Simon, what's your use of the concept dysfunctional? What's my use of the concept dysfunctional? There's two thoughts that come to mind right away, Simon, and it's out of context, like out of a conversation. I am just wanting to make sure I'm clear. Sometimes I use dysfunction to describe curtain three, to describe when it's off, to describe when it's awry. I have used dysfunction before meaning that. And here's when you felt my pause, here's why I pause on that. I have at times used with patients, this is a dysfunctional use of this joint or this action or what have you. And it really starts to feed into their brokenness, right? And you can't get to their wholeness from their brokenness. You can't get there from there. So what I don't want to do is make them feel worse for wear with my high level words, or more afraid of how far away they are from the solution that they're looking for, or disconnected from their body, or afraid of what I might find. If I'm like, well, I'm here with all the knowledge and you have this dysfunction in your body, can you see how divisive that is? So I don't use that word anymore for work with clients. Okay, good. I'm glad that's landing for you. Simon, thanks for the thumbs up. I don't use that word anymore clinically. I have used it to train with though. Like this is not the way it's designed. This is when it's awry. This is a dysfunctional use of that body part. In fact, I was just traveling, as you guys know, and I'm just one of my favorite people on the entire planet, one of my best friends of all time. Meaning, and I'm sharing that to say, like, conversations open, we love and trust each other, like we're kindred in all senses of the word. And we were sharing a hotel room and talking about each other's breathing patterns at night and who was keeping the other awake, and we were both both responsible for that. And she said, the only time I'm not breathing is when I'm laying on my stomach. And I was like, don't ever do that. It's the worst thing you can do for your neck. And she said, I can't believe that that's true. How is that worse? And I said, back sleeping is the way to do it. She's like, no, no, that's terrible. That's my husband snores when he's on his back. I'm like, that is the most optimal use of that body part though. And she's like, I don't understand. That makes no sense to me. And so, you guys know, as we've looked at Murph, this is the design of the spine, right? This is not. So that would be a dysfunctional pattern to keep repeating. So I don't use, again, the word dysfunction to tell people who are, in my care that are afraid or in pain. I don't use it in that way, but I do use it to land a point when I'm teaching. Like that is a dysfunctional use. That is going to create all of these implications functionally down the pike. Don't do that. So I've been, sort of floating away from that word, although there are dysfunctional patterns for sure, meaning they lead to an interruption of the functional design. So I would just use the word in that way. Okay, my friends, I kept you a couple extra minutes to get that full definition out there. I hope there was value for you. Was there value for you? Did you learn something new about symptoms, Gary? You did? Oh, I'm so happy.
Thank you for your dedication.
Oh, my
Yeah,
absolute pleasure. My absolute pleasure.
yeah.
All right, my friends, I will see you guys again next week. We are in a new month. We are going to start a new topic, and next Tuesday is my birthday. So I hope you guys all come and party with me live. I am that dedicated that I would rather be here talking to you guys, talking shop, and that's like part of my birthday celebration. So please come live and hang out with me next Tuesday, and we'll start a new month, a new year for me, and we'll continue our journey together. All right? Okay, guys. See you guys next time. Bye for now.